So we're going to shift gears a little bit and centralize our evaluation. We're going to look at major arteries of the abdomen today. And I'm going to start off with the aorta, the conduit that feeds all our visceral vessels. No disclosures, no conflicts of interest. Just as a reminder, the evaluation of the abdominal aorta is considered a screening examination, basically CMS covered, but the code that has to be used to get the reimbursement is a specialized code because the exam is also specialized. And a standard abdominal ultrasound code will not work with the indication screening. This is an elective examination. It's not an emergent examination. You don't expect to go in and look at the abdominal aorta acutely. We're talking MR, not even MR, CTA in most instances there's something. But since this is elective, we have time to have the patient NPO, minimize the amount of gas. Even smoking or chewing gum may hamper the examination. No bowel preparation and no attempt to do multiple tests like endoscopy on the same day, which would really not work very well. So the abdominal aorta tapers. It starts at the diaphragm, and then it continues from the thoracic aorta, crosses the diaphragm, and tapers progressively. The abdominal aorta in men is slightly larger than that in women. Typically, it would be less than 2.3 centimeter in men and 1.9 cm in women. Now, throughout this presentation, there's one thing you have to remember, the number 3 centimeters. That's the number we look at for the definition of an abdominal aortic aneurysm. Using that definition or a relative ratio, that is, if you look at the diameter and you see a bump of more than 20%, this study, which was part of the cardiovascular health study, looked at the prevalence of abdominal aortic aneurysms. And this confirmed what we know already. There are many more men that get abdominal aortic aneurysms than women. However, that being said, the disease is a bit more aggressive in women. There's a higher likelihood of a complication, and the major complication is rupture at a given size. So women, less prevalent, but if they have it, a little riskier for them. The most common type of aneurysm is basically a fusiform aneurysm. And these aneurysms have the 3 walls intact, the intima, the media, and the adventitia. You can have less common eccentric aneurysm. They bulge preferentially in one side. And then the very rare uncommon saccular aneurysm that basically a portion of the wall of the abdominal aorta has been violated. In this diagram, you can see that the intima has been ruptured, but the other walls are still there. So this is not a pseudoaneurysm. It is a saccular aneurysm.